All right, welcome back. We are still joined by Miss Phyllis Peoples, the CEO of Terrebonne General Medical Center. And I know you well enough, so I can say this. When you are faced with a problem, you don't take it lightly. You sort of roar through it. But I know you well enough to know that if somebody comes to you with a problem, they better have a solution to go with it. Y'all had some major problems at Terrebonne General. Talk about the infrastructure, but talk about what y'all have done to maybe correct some of those things.
Yeah, if I could, let me kind of talk real quickly about some of the journey of the night. Is, we were doing a really, like every hospital, a really good job of being able to sustain our services. And then we started to have water pouring in. And it started pouring in from the 5th floor, and not a little, a lot. And then it continued to pour into our 4th floor and then our 3rd floor. So then as we started having staff and patients in rooms, as you can see from the picture, all of a sudden the windows all started blowing in the patient rooms. And what was interesting was we started seeing large concrete blocks flying through the windows and landing on the patient bed or something like that, which was a bit unnerving, as you can imagine. We move our patients to the center core, and then we had to start moving them in the hall. But things started caving in, and it started caving in greatly. And as you can see, that's why we made an all-hands-on-deck call, because the more that goes from the 5th, 4th, and 3rd ends up, you can see it's raining, goes into all of our equipment and our stuff on the 1st floor, and then it creates a big issue for us. That in the morning, what we determined is we needed to assess in the morning what our level of damage was, because again, what would it be for us to maintain operations? And what we found, if you could go back to the picture we just saw, so people could know, that's our roof. Our roof pretty much exploded, for lack of a better description. They're concrete blocks, and as you can see, they have a moisture barrier or whatever underneath it. And what we anticipate, or what I've been told, is that the wind got so forceful, it pulled off all the flashing, it got underneath, and the 4 corners were shaped kind of in a frog style, for lack of a better, with 4 wings, and it blew off all the corners of all the roof. So where we thought maybe there was some tarping we could do, it is quite evident that you have a puzzle to put back together, get those chunks down, and you can't just tarp it. So we have to secure those roofs, and at that point, I don't have water, I don't have electricity, I'm on generator power that's not running so very well, and water is pouring in every place, and our patient rooms look like that. I can't do basic life safety codes. I can't put something out if I have electrical fire, I don't have water, I don't have a safe environment at all. And at that point, it was a very difficult decision, easy to understand from the safety, but from a personal one, to admit that we just can't continue to serve our community and patients was difficult. What you see here is to evacuate 120 patients is a monumental feat. You have to start calling the state to ask for assistance. We were able to get Ochsner called right away to say what could they do to help, Acadian ambulance people, and they stood in line and they were trying to transfer our patients. You could see the number of ambulances. But we have to, number one, notify family members, and at this point there is no communication.
Right. And can I say something? People were asking us, well, why y'all not filming the evacuation at Terrebonne General? HIPAA. We can't go in there and zoom in and see somebody's loved one right there. There's no compassion right there. So we let y'all do y'all job.
Right. And it was 80-something degrees that we're sitting here trying to manage in. We as you know, the patients, it's sweltering. People, it took a full 24 hours of nonstop transfer. You got to find beds. And I got a majority of COVID patients, so you got to find facilities who are able to take these COVID patients and be able to house them. Also, you got 30 ICU patients. So we got to find not one hospital can take all 30.
How logistically do y'all pull that off? That's unimaginable.
It's monumental. You have a war room, and you bring in the Acadian people. You bring in Ochsner, who's, again, I want to reemphasize how they said they'd send helicopters. We had Black Hawk helicopters. We had Acadian helicopters. We had people landing left and right, and I think we got a couple pictures. We have them at night. It went through the night. It went through the day. You can see all the debris from the roof and things that we have. We got staff who, our heliport was damaged. So you got to land in a parking lot that we had to clear just to be able to find the organization. Some people ended up having to go to, we tried to stay in the state of Louisiana for the most part. Some went to Singing River in Mississippi because they're affiliated with Ochsner, and so they were able to secure us 20 beds there. And trying to get in touch, our hospitalist Nathan Sutton, everybody knows Dr. Nathan Sutton and Dr. Andrea Lorio were with us the whole time, and they're contacting families. But you have a rain event, they're standing on the only way a satellite phone works is if you're outside, by the way. We learned that.
Right.
And that's not optimal in a hurricane.
Right.
But after the hurricane and the rain, we're all doing what we have to do to try and contact families to let them know where their loved ones are going.
Let me ask you this, the staff. What happens, that's logistical too, but the staff goes, but just because they leave the hospital for a few days, they're making phone calls and doing different things, so everyone's still working, aren't they?
Well, phones didn't work for us.
Well, very true.
And electricity didn't work for us. Internet was down for us. And so people asked, why is the hospital somewhat silent at the beginning?
Mm-hmm.
Because our towers, or the lines that came to the hospital, were cut in the disaster, and we really had no communication in or out. It made it very, very difficult. Satellite phones and walkie-talkies aren't an ideal mode of communication, I can assure you.
Right.
But once staff left, we couldn't get them back, and
Mm-hmm.
so we really tried the best we could. Once we got our patients out on Tuesday, the event happened Sunday. We decided to evacuate on Monday.
Mm-hmm.
It took us till Tuesday, and by Wednesday or Tuesday, we still trying to figure out how can we offer services, and by Thursday we were setting up ER services outside and tents and things in our whole ER team. By Friday we were operational.
Yeah, that was amazing how quick y'all got that up. And I want to spend the next segment talking about, in this segment we can mention, you sat down face to face with the governor. What kind of response did you get?
Amazing. I have to say amazing. People recognize the need for health care.
Mm-hmm.
They recognize how to support all of us in this kind of initiative, and especially large and small facilities. And he said, we're going to do whatever we can to get you back because the community has to have it.
Yeah.
You have to have it. And we agree, of course, and we feel an immense responsibility to our community to provide
It's the
medical
pulse of
care.
the community. I mean, excuse the pun, it's the lifeline of the community. I mean, who wants to go live in a city that doesn't have a hospital? But y'all are moving pretty
Oh.
good right now.
And we
Y'all
can talk about that, but I do want to say our concern was people are coming back using chainsaws, things, chopping things. We had a lot of lacerations. You have
Mhm.
tetanus issues. You have injuries. You have people short of breath. You have COVID still is rearing its head.
Mhm.
We have all of those things that if we didn't get emergency care up in some capacity, people can't drive 20 miles or 40 or 60 miles for care.
Sort of reminded me, maybe a bad example, but watching the movie MASH where they had the tents all up and everything, and you just taking care of them as they come in. We'll take a short break. We're going to be right back with the CEO of Terrebonne General Medical Center. Don't go away.